Welcome to the 2025-2026 UT Dallas Employee Benefits presentation. On behalf of the Human Resources Employee Benefits team, we'd like to extend a very warm welcome to everyone here today. We're excited to have you as part of the UT Dallas community. In today's session, we'll be walking through the wide range of benefits and retirement plans that we offer to our employees. These benefits are designed to support your health, well-being, and financial future, so we want to make sure that you have a clear understanding of what's available to you as part of your employment here at UT Dallas.
Today's agenda includes the following. First, we will go over benefits eligibility. This will cover what classifies an employee as eligible for benefits under the UT insurance program. In the benefits overview, we will discuss some important key items and the various enrollment deadlines you'll need to be aware of. We'll then dive into the benefit plans offered, including both mandatory retirement and voluntary retirement plans. Following that, we will walk through the enrollment process, which will guide you through the steps to enroll in your benefits. And finally, we'll wrap up with important reminders and some helpful resources that will ensure you have all the information you need to make the most of your benefits. With that, let's go ahead and get started. Benefits eligibility. At UTD, benefits are offered to full-time and part-time benefits-eligible employees working in a faculty, staff, or RATA appointment. Employees working 30 to 40 hours per week are considered full-time benefits eligible. Employees working 20 to 29 hours per week are considered part-time benefits eligible. If you experience a change in your appointment that impacts your hours, it is important to know how this change affects your benefits. For instance, if you move from a full-time position, working 30 to 40 hours per week, to a part-time role, working 20 to 29 hours per week, or vice versa, you will remain eligible for benefits. However, your medical premiums may change, and we will cover premiums in more detail in upcoming slides. Now, if your position changes to working less than 20 hours per week, you will no longer be eligible for benefits, and your benefits will end at the end of the month in which your position changed. Eligible dependents may be added to your coverage, which include a spouse. This includes same-sex spouse, children up to age 26 with their coverage ending at the end of the month in which they celebrate their 26th birthday. Grandchildren may also be covered if they are claimed as dependents on your tax return. Handicapped children with medical incapacity who are unable to support themselves can be covered with no age limit. A separate application is required, so please contact the benefits office for assistance with this process. In addition, children under your legal guardianship or custody are also eligible for coverage. You will need to provide documentation to establish proof of relationship. For a spouse, you will need to provide a marriage certificate. If you're in a common law marriage, you can submit a declaration of informal marriage certificate. For dependent children, you will need to provide a birth certificate or any legal document that establishes proof of relationship. In the event that you leave your employment with UT Dallas, or when your dependent ages out of your plan or has a status change, you and or your dependents will be offered COBRA coverage for the essential plans you were enrolled in at the time of the change. A COBRA notice and application will be mailed to the home address on file, and you'll have 60 days from the date your coverage ends to enroll in COBRA. If you decide to enroll, your COBRA will be effective the first of the month following your coverage end date at UT Dallas. COBRA coverage is generally extended for an additional 18 months. Benefits overview. As a benefits eligible employee, both the state of Texas and UT Dallas contribute premium sharing funds to help cover some or all of the cost of your basic coverage package. The amount of premium sharing you receive depends on your employment appointment. In most cases, the university will contribute a significant portion of your premiums, making your benefits more affordable. For full-time employees, UT Dallas provides 100% in premium sharing funds to cover the cost of enrollment in the employee-only medical coverage package. For part-time employees, you receive 50% of premium sharing funds. The basic coverage package includes enrollment in the UT Select Medical Plan with prescription drug coverage, 50,000 in basic group life insurance, and 50,000 basic accidental death and dismemberment insurance. Now, while we call it the basic coverage package, there's truly nothing basic about it. This is a comprehensive, robust plan that includes a variety of additional benefits, many of which are not typically offered with standard medical plans. Full-time employees are automatically enrolled in the basic coverage package as of your hire date or eligibility date. Again, there's no cost for employee-only coverage, and in fact, this results in a saving of $780.24 per month for full-time employee-only coverage. This adds up to over $9,300 per year. Part-time employees, on the other hand, are not automatically enrolled in the medical coverage because there is a cost to participate in the plan. You will need to log into the MyUT Benefits enrollment portal to actively enroll in coverage. All employees have 31 days from your hire date or newly benefits eligible date to enroll in optional coverage plans. It is important to note that the eligibility date starts as of day one of your employment or benefits eligible date with UT Dallas. There is no waiting period. However, you do have the option to make your coverage effective date on the first of the month following your start date. You may choose this option if, for example, you're still covered under a prior or another employer plan, or if you prefer not to have coverage for a partial month. If you'd like to change the effective date of coverage, simply email benefits@utdallas.edu to request a change after completing your enrollment process. When requesting an effective date change, all the benefit plans you're enrolled in will become effective the first of the month following your hire date. This is mainly useful since premiums are not prorated. This means you'll pay the full monthly premium even if your initial coverage is for only part of the month. Lastly, there is another aspect of premium sharing benefits, which we will talk about in a later slide, called premium sharing credit.
Let's now go over the important enrollment opportunity deadlines. The UT Benefits Plan offers several key enrollment periods throughout the year, each serving different purposes and eligibility criteria. The first opportunity to enroll is as a new hire or newly eligible employee, and as discussed, full-time employees are automatically enrolled in the basic coverage package. All employees will have 31 days from their date of hire to enroll in benefits. This includes enrolling in optional coverages, adding your dependents to your plans, or even waiving the medical plan if you choose to do so. Your next opportunity to make changes to benefits is during UTD's annual enrollment period, which takes place every July 15th through July 31st. During this 2-week window, all eligible employees can review and make changes to their benefits which apply for the upcoming new plan year. At UTD, the plan year resets every September 1 and ends August 31st. If you are a July or August new hire, or you recently became eligible for benefits between July 1st and August 31st, you may need to complete a dual enrollment to select benefits for the current year as well as the upcoming plan year. Your first enrollment will be to select benefits for the remainder of the current plan year, which ends August 31st. You will then save down your elections and have an opportunity to complete your annual enrollment benefits, which is considered the second enrollment, and will be the plans that you have in place beginning September 1, 2025 through August 31st, 2026. Outside of the new hire window or annual enrollment period, the next opportunities that you have to make changes mid-year to your benefits is when you experience a qualifying life event. Qualifying life events allow you to adjust your benefits to better meet your needs. According to the IRS, all qualifying life events must be reported within 31 days of the date of the event. Examples of qualifying life events include, but are not limited to, the examples shown on the slide, some common ones including marriage, divorce, or having a baby. If you have a qualifying life event mid-year, you'll have 31 days to report it from the date of event, and you will also be asked to upload proof of your event, as well as eligibility documentations if you're adding dependents as part of your life event for the first time. Staff at UTD are paid on a monthly schedule, and insurance premiums are deducted in arrears. These are the monthly premiums for benefit plans based on the coverage level tier selected. These rates will be in effect for the 25-26 plan year that begins September 1st, 2025 and ends August 31st, 2026. We've also included a link that will share the prior year plan year rates that will be in effect through August 31st, 2025.
We will now move on to review the benefit plans available to you. Our medical plan is administered by Blue Cross Blue Shield of Texas.
The medical plan offered at UT Dallas is the UT Select Medical Plan administered by Blue Cross Blue Shield of Texas. This is a self-funded, preferred provider organization, also known as PPO plan, that provides access to a substantial network of Blue Cross Blue Shield providers and facilities. Under this plan, you may receive care from any licensed doctor of your choice with no referral required. The plan offers coverage for both in-network and out-of-network providers and facilities. And to see a specialist, you simply need to find a provider that's in the network and contact them directly for an appointment. When a provider or facility is in-network, it means they have a contractual agreement with Blue Cross Blue Shield to charge based on an agreed rate. Your savings comes from utilizing these in-network providers, as you will only pay the expected charges and avoid being balance billed. In contrast, visiting an out-of-network provider who does not have a contract with Blue Cross results in Blue Cross paying a portion of your out-of-network medical claim. However, these providers can still bill you for the remaining difference, leading to a higher out-of-pocket cost. In terms of your annual preventative care and annual preventative visits, such as physicals, well women's care, flu shots, all of those are examples of annual preventative care, which is covered at 100% when you visit an in-network provider. Another great advantage of using network providers is that they will submit claims directly to Blue Cross for you, saving you the hassle of managing paperwork. With that said, on this chart, we will focus only on the in-network level of services and what you can expect when utilizing your UT Select plan. As a friendly reminder, the UTD benefits plan year resets every September 1. These are the benefits that will be in place beginning September 1, 2025 through August 31st, 2026. In parentheses, we have noted the differences that apply to the prior year, which only will continue to apply through August 31st of 2025. And then again, everything else on the slide that's not in parentheses is what's in place beginning September 1st, 2025 for the rest of the plan year. Let's now begin the review of the coverage details, beginning with the plan year deductible. This is the amount that you must pay for healthcare services before the insurance plan will begin covering and sharing the cost with you on your behalf. The plan year deductible is $600 for an individual with a family deductible not exceeding $1,800. Next is coinsurance. This is a percentage of the bill that you must pay once you've satisfied your deductible for the plan year. Once you satisfy your deductible, the insurance plan will now begin sharing that cost, and the plan's sharing of the cost would be 80% of your eligible medical service bill, and members are responsible for paying 20% of the cost. Next is the coinsurance maximum, which is the highest amount that you would pay in coinsurance dollars. In other words, every time you pay 20%, and the coinsurance max would be reached once you've hit a threshold of
$5,000 per individual. Once the coinsurance max has been met, insurance from then on will cover 100% of the coinsurance costs for the rest of the year, meaning you no longer have to worry about paying 20% of a medical claim. However, you will continue to be responsible for paying medical copays as well as prescription copays. Next is the annual out-of-pocket maximum. This is the total limit of how much you will have to pay for healthcare costs in a given plan year. After you have met this amount, which is inclusive of your deductible, the coinsurance maximum, as well as medical and prescription copays, if you reach this annual out-of-pocket maximum, at that point the plan will cover 100% of eligible in-network costs for the remainder of the plan year. Keep in mind the out-of-pocket maximum does not include your monthly premium. The annual out-of-pocket maximum for the new plan year is going to be $9,200 per individual and $18,400 per family. Next is copays, and the expected copay for a primary care visit is $30. Therapy copays are going to now be $40 as of September 1st of 2025. Specialist copays will be $50 and urgent care copays will be $50. Again, no referrals are required. If you have a home address in our employee database that is outside of the state of Texas, New Mexico, or Washington, D.C., please be aware that there is a second plan known as the UT Select Out of Area Plan that you would be enrolled in if your area of residence is outside of Texas, New Mexico, or DC. While the plan design differs on the out-of-area plan, the premiums will remain the same. If this applies to you, you're welcome to review the out-of-area network details listed on the UT System website.
Premium Sharing Credit Plan. If you do not require the UTD medical, you may want to consider enrolling in the Premium Sharing Credit Plan. Employees are eligible to participate in this plan when they choose to waive or decline the UTD medical because they already have an outside coverage of medical insurance provided through a group employer insurance plan, or perhaps if you're covered through UTD's student health plan or TRICARE or Medicare. By enrolling in this benefit, you will have access to a monthly reserve of credit that can be used to offset the cost of optional coverages for yourself and your dependents. This may be an option that would offer you the best dental, best vision, and the voluntary AD&D maximum benefit at no cost. If you're a full-time employee and can provide proof of outside medical coverage and it's approved, you would have access to $421.33 per month in credit. Or if you're part-time and you're approved for this plan, you would have access to $210.67 per month in credit. As an example, families and colleagues at UTD who take advantage of this option may already have their family covered on another outside medical plan. They apply for this option, they provide their proof of outside medical coverage, and if approved, they can enroll in up to the family level of coverage for the best dental plan, which normally would cost $183.30 per month. The best vision plan at the family level would be $18.10. Maximum AD&D would be about approximately $20 or less. It's an approximation because it does consider salary. So all in all, if you were to pay for those options out of pocket, it would be around $221.40 per month. However, using this example, and if you're full-time, the full-time credit would exceed the out-of-pocket costs, and once the credit is applied, it means that you would owe $0 and you would have access to have those coverages up to the family level completely free. Some things to note about this option. The premium sharing credit is not something that's paid out as earnings on a paycheck. It can only be used to offset the cost of dental, vision, and AD&D plans at UTD. Any unused credit is
forfeited and not ever included on a paycheck. Keep in mind, if you do waive the medical package, you're also waiving the free life insurance and the free AD&D insurance, as well as prescription drug coverage. To enroll in this plan, you would log into the MyUT Benefits portal. You would decline the medical and select premium sharing credit, and then enroll in the dental, vision, and AD&D for you and your eligible dependents. You will then upload proof of your outside medical coverage via the Document Center. So in the beginning, you will see a cost reflected, and that's expected to allow time to review your proof of medical coverage. Once approved, then the credits would be applied and the cost would be dropped. Please note examples of insurance that is not acceptable for this option would be coverages purchased through the marketplace exchange, private insurance plans, or medical insurance through an ISD are examples of outside medical coverage that would not qualify for this plan. Employees enrolled in the UT Select Medical Plan can access tools and resources provided by Blue Cross Blue Shield that include virtual care visits by MDLive, which is a service that offers you access to a virtual doctor's consultation at zero out-of-pocket cost. With MDLive, you will have access to 24/7 year-round care where you can have a consultation with a doctor through your phone, mobile app, or online. This service is meant for non-emergency medical conditions such as your seasonal allergies, pink eye, rashes, and more. It also offers support for behavioral health concerns such as depression, anxiety, or perhaps if you're struggling with coping with loss. This is also still provided to you at $0 copay. With MDLive, another added member convenience is that providers may request prescriptions for you to make it easy, quick, and convenient for you to pick up a prescription at your local in-network pharmacy. In addition, other resources offered by Blue Cross Blue Shield includes a 24/7 free nurse line, which offers you the opportunity to speak with a registered nurse at any time, day or night, to get medical advice or guidance. You can also access a identity protection resource that's available again to UT Select plan members at no cost. With this identity protection, which is offered through Experian, you will get free credit monitoring, free fraud resolution services, and identity theft protection. Another extremely valuable resource available to the members of the UT Select Blue Cross Blue Shield plan is access to the VIP level of customer service offered by Blue Cross Blue Shield, known as the UT Select Concierge. The concierge team is made up of registered nurses, social workers, and behavioral advocates, and all of that team can assist you with different services, such as if you need assistance with finding in-network providers and facilities, they will do that research for you. They can even schedule your doctor's appointments for you and your covered family members. If you are needing to have a medical procedure completed, they can help with providing cost estimates for that procedure at different places. They are also considered your personal benefits assistant. You can call them. They will walk you through and explain exactly how the coverage works, how the benefits apply for eligible services. If you have any medical bills that you're questioning the accuracy, you can call them. They will review it for you, and if there is an error, they will contact your providers and resolve it on your behalf. You can also call them for assistance with ID cards and so much more. To take advantage of this VIP level of customer service, you can always call the number on the back of your Blue Cross Blue Shield ID card. UTD Wellness and Benefits Programs. At UTD, we offer an employee wellness and nutrition health promotion program for all UT Select medical plan members. The program is led by Taylor Tran, who is a member of our HR employee Benefits team and serves as the Wellness Program Manager. She brings nearly 20 years of clinical and research experience, having previously worked at MD Anderson and UT Southwestern. If you've ever had to meet with a dietitian, you're well aware that the cost can be hundreds of dollars per session. Taylor Tran is a registered and licensed dietitian and is an available resource to UT Dallas employees at zero out-of-pocket costs. You have access to your own very on-site licensed and registered dietitian. Some examples of what Taylor may assist with are things like lifestyle modification, nutritional coaching and counseling, connecting you with a smoking cessation program, and she also manages the wellness events on campus. If you would like to schedule an appointment, you're welcome to contact her directly to set up a time to have a one-on-one session. Additional wellness programs available to UT Select members include Wonder Health, which is an online program to help you with weight loss. You can also have access to Ovia Health, which is a maternity family app to help support you through your parenthood journey. We also have Progeny, which offers fertility and family building benefits to members who are enrolled in the UT Select medical plan for at least 12 months before you can access the benefit. Learn to Live is a behavioral health digital platform that can help with depression, stress, or anxiety. Centered App is a Blue Cross Blue Shield application that's available to help reduce stress through mindful meditation and daily activities. There are more programs that you can explore and research by visiting the www.livingwell.utsystem.edu website. On that website, you will also be able to have access to the UT Living Well platform, which is powered by Limeade. Through this platform, you're welcome to create a profile, which will then allow you to participate in well-being and engagement activities where you can earn points to win prizes. You can also complete a well-being assessment through this platform, and again, have your chance to earn raffle prizes and help you reach your goals to achieving your best self. To get access and to get started on the UT Living Well platform, you can download the app, then you will enter University of Texas System or UTX to begin tracking your progress.
The prescription drug plan is included as part of the UT Select medical package, and it is managed by Express Scripts. With Express Scripts, there is an annual deductible of $200 per person, separate from your medical deductible. Remember that our plan runs from September 1 through August 31. Once the deductible is met, your copay will apply. The amount of your copay depends on the type of medication you are taking and how you choose to fill that prescription. You can fill your prescription at a retail pharmacy and receive a 30-day supply. You can also choose the home delivery, where you can opt for a 90-day supply delivered to your home address. We also have the Smart 90 Retail, which is available at Walgreens or UT Pharmacies, where you can get a 90-day supply instead of using the home delivery service. UT Select uses a 3-tier co-payment structure for prescription medications as outlined in this table. Under this system, you will pay the lowest copay for generic medications, a mid-level copayment for brand name medications on the preferred list, and a higher copayment for non-preferred brand name medications. If you choose a preferred or non-preferred brand name when a cheaper generic alternative is available, you may be required to pay the price difference between the brand name drug and the generic, plus applicable generic copayment. Specialty medications are exclusively provided by Accredo and UT Specialty Pharmacies. Make sure to speak to a case manager to set up specialty medication approvals. For more information on coverage for specific prescriptions, you can visit the provider link or contact Express Scripts directly. In addition to the UT medical plans, you have the option to enroll in other optional plans, including dental, vision, life, and disability coverage. It is important to note that you do not need to enroll in the UT medical plan in order to participate in these other plans. You have the flexibility to choose which plans you wish to enroll in and which you prefer to decline. So let's get started with dental. The administrator for our dental plan is Delta Dental. We offer 3 dental plan options. The Dental Select and the Dental Plus plan are both PPO plans which can be used nationwide. The third plan is a Delta Care HMO plan, which can only be used in the state of Texas. For the PPO plans, you can choose any licensed dentist nationwide, and the plan provides both in-network and out-of-network coverage. To maximize savings, it's best to use in-network providers. In-network dentists are required to charge you based on an agreement with Delta Dental. If you go out of network, you run the risk of getting balance billed. This means you will be charged for the difference between what the plan covers and what the dentist charges. The Dental Select plan has a $25 per person annual deductible and a $1,250 annual maximum per person, while the Dental Select Plus has no deductible and offers $3,000 annual maximum per person. Once the plan reaches its annual maximum, you will be responsible for any remaining costs until the new plan year starts on September 1. The Delta Care HMO plan is in-network only and available only in the state of Texas with a smaller network compared to the traditional PPO plan. It is the most affordable option, but it does have limitations. Treatment costs are based on a published fee schedule available on the UT Systems website. If your dentist provides the procedure code, you can check the expected cost ahead of time. There is no annual maximum with this plan, so if you need extensive treatment, it could be the good fit for you. Regarding orthodontia coverage, it applies to both children and adults, usually on a lifetime basis. This means if you've had orthodontic treatment in the past and used your benefit, you won't receive benefits again, especially if your prior orthodontic benefits was provided by Delta Dental. Let's say you're enrolled in the Delta Select plan and your child has received orthodontic treatments during the plan year, maxing out 1,250 orthodontic limit, but you then decide to change to the Dental Plus plan during annual enrollment in July. Your child will now have an additional 1,750 available in orthodontic benefits. This is the remaining balance from the lifetime max, not a new 3,000 max. No matter which plan you choose, preventative evaluations and cleanings every 6 months are covered at no cost to you when using an in-network dentist. Our vision plans are administered by Superior Vision. There are 2 options available. We have the Superior Vision Standard Plan, and then we have the Superior Vision Plus, which is an enhanced plan. This chart provides a comparison of in-network benefits, but both plans do offer out-of-network coverage. The primary difference between the 2 plans lies in the cost of frames and the elective contact lens retail allowances. The Vision Plus plan offers higher benefit allowance per enrolled member, making it the more comprehensive option. Again, both plans provide benefits for both in-network and out-of-network services. However, if you choose an in-network provider, you only pay the agreed-upon contractual rates. Coverage is limited to 1 service per plan year, so if you use both glasses and contacts, it is important to plan accordingly, getting glasses 1 year and contacts the next.
Now we will be reviewing the UT Flex accounts administered by Inspira Financial. UT Flex Healthcare Reimbursement Account. At UT Dallas, we do not offer a health savings account known as an HSA. However, we do offer a UT Flex Healthcare Reimbursement Account, which is a type of flexible spending account offered through the University of Texas system. This account enables employees to set aside pre-tax dollars to help cover your eligible medical, pharmacy, dental, and vision expenses that are not covered by insurance. Examples of expenses that you can use these funds for is your medical copays, prescription copays, medical supplies, dental treatments, eye care, and by contributing to your healthcare reimbursement account, employees can lower their taxable income and use the funds for qualifying expenses throughout the plan year. It's a valuable way for you to save money on taxes, all while managing your out-of-pocket healthcare cost. For the 2025-2026 plan year starting September 1 of 2025, the new annual limit that you can enroll in is $3,300, which is an increase of $100 in comparison to last year's maximum limit of $3,200. The minimum contribution that you can contribute is $180, but you're welcome to choose any amount between $180 up to a max of $3,300 for the new year. Enrollment in the UT Select Medical Plan is not required to participate in the UT Flex Healthcare account. And again, if you are an August new hire and completing a dual enrollment, if you would like to add Flex for August 2025, which is the final month of the 24-25 plan year, please email us a written request to benefits@utdallas.edu with your desired annual amount. Because August 2025 is the final month of the prior year, if you enroll in Flex, it will require deducting your full annual amount from your next immediate paycheck. During your dual enrollment, if you add Flex for the second enrollment, which is considered your annual enrollment elections, your health care annual amount will be divided either by 12 or by 9 based on your salary spread, which is then used to calculate how much is deducted on a monthly basis from your paycheck for this plan. The Healthcare Flex Plan is a pre-funded benefit, which means that the full annual amount is available as of the first day of you receiving your card in the mail. Contributions, again, will be deducted from your paycheck on a pre-tax basis, which helps lower your taxable income. If you're interested in estimating your potential tax savings, you can go to the myutflex.com website and use the calculator tool, which does not require logins to access the tool. Once you have enrolled in the plan, you can expect to receive a debit card in the mail within 7 to 10 days that you can begin to use for your eligible out-of-pocket expenses. The card will work just like a regular bank debit card, and it will be valid for 5 years. Even if you exhaust your funds, if you renew your enrollment in the Flex plan during the next year's annual enrollment, your existing card will automatically be reloaded with the new amount you enrolled in for next year. So please make sure not to throw away your card. You're always welcome to request additional cards at no charge. When requesting reimbursements from this account, you can request reimbursements by logging into the portal if you happen to pay for something out of pocket, perhaps because you forgot your card at home. Otherwise, you can use your card to pay for eligible expenses. If you do find yourself needing to file a manual reimbursement, you can do so by downloading the mobile app and requesting it through your smartphone, or by creating your online member account and logging in and reimbursing yourself through your bank's direct deposit. Details, and please be aware that you will be required to upload proof of your eligible expense that should include your name, the expense, the amount, and a description of the expense to avoid your receipt being denied. When considering this benefit, you must be careful in estimating how much you would like to load for the new year, as the risk to this plan is the IRS use it or lose it rule, which requires you to forfeit any unused amounts that are remaining by the end of the plan year. To help with this risk, there is an added grace period that allows you until November 15th to use up the funds before you're at risk of forfeiture. The claim filing deadline is November 30th. where you can still submit requests for reimbursement as long as your expenses were not incurred past November 15th. One way to avoid forfeitures is you're welcome to go to the fsastore.com online, where everything on the website is considered an eligible expense. Lastly, according to the IRS, every year to continue this specific plan, you will require to log in during annual enrollment to re-enroll for the new year. A dependent care FSA allows you to contribute pre-tax dollars to help cover eligible dependent care expenses such as child care or elder care for dependents who rely on you. The eligibility rule for this plan requires that the dependent care expense must be necessary for you and your spouse to either work or attend school full-time. Eligible dependents include children under age 13 or any dependent of any age who is disabled and claimed on your taxes. Examples of eligible expenses include daycare, before and after school programs, nursery school, senior daycare, and more. This account is not pre-funded, which means that you can use funds as they are available once they are deducted from your paycheck each month. For reimbursement methods with this plan, you'll have options to submit claims online, through the mobile app, by mail or fax, or paid providers directly online. Please note that this benefit does not include a debit card option. Similar with the healthcare FSA, the dependent care FSA also has the use it or lose it IRS rule that applies, which means that any unused funds in the account after the deadline will be forfeited. Also, just like the healthcare FSA, if you are an August new hire and you're completing a dual enrollment, if you're interested in adding the Dependent Care Flex for the month of August 2025, which is the final month of the prior 24-25 year, please email us a written request with your desired annual amount at benefits@utdallas.edu. This requires a written request because your full annual amount, because it's for the final month of the prior year, will be deducted in whole from your next immediate paycheck. If you decide to add Flex as part of your annual enrollment or second enrollment option, the system will then take your desired annual benefit and divide it by the total number of paychecks in the year. And that is how the monthly pre-tax amount will be calculated. Important dates to remember. With this benefit, your last day to incur expenses is August 31st. You have a claim filing deadline of November 30th, which means you can still submit claims for reimbursement as long as the expense was incurred through August 31st. There's no grace period for this benefit, so August 31st is the last day to incur expenses. With the contribution limits, the maximum is $5,000 for employees filing jointly or as head of household, or up to a max of $2,500 if you are filing as single or separate. If you have any questions or concerns about what is the best tax strategy, the guidance is to meet with a tax professional to look at your personal family details, your income details, your tax bracket, and they'll be able to guide you on what the best strategy is for your family.
Next, we will review the disability, life, and accidental death and dismemberment plans, which are also managed by Blue Cross Blue Shield of Texas.
Disability plans. The disability insurance that is provided at UT Dallas is meant to be a means for financial support in the event that you become unable to work due to an illness, an injury, or other medical condition. You can choose from short-term and long-term plans, or choose both, as they are designed to support you during different periods of incapacity. With the short-term disability plan, the maximum benefit payable would be up to 22 weeks once you have satisfied a 7-day period of being absent from work due to a medical condition, or once you have exhausted all of your sick time. If approved, you would get a weekly paycheck that would be 60% of your earnings, up to a max of $850 per week. That benefit would continue to pay out so long as you were continuously disabled for up to a max of 22 weeks. If your disability is linked to a pre-existing condition, the maximum period payable would drop from 22 weeks to 4 weeks instead. However, please note that the pre-existing condition clause only applies during the first 12 months that you're on the benefit. If you've had the insurance for more than a year and then you file the claim in your second year, you no longer have to worry about the pre-existing condition clause. The next plan is the long-term disability, and with the LTD benefit, it would begin once you have satisfied a 90-day period of having been out due to a disability in which you have been continuously disabled. Similar to the short-term plan, the long-term plan would also require that you exhaust all of your sick time before benefits are payable. With the long-term disability plan, as far as how long it would continue to pay out, the monthly paycheck, which would be 60% of your monthly earnings, not to exceed $15,000, would depend on the age you were at the time of your disability. So on the slide, we have the chart that is organized based on age bracket, and we'll show you how long the long-term disability benefit would pay for based on your age at the time of disability. The premiums are not included on this slide because they do take into account your salary. When you're doing your enrollment online, you'll be able to see the total monthly amount for these benefits. As a July and August new hire, if you're completing a dual enrollment, you have a special opportunity to enroll in short-term and long-term disability plans with no questions asked about your medical history. In other words, the requirement for the evidence of insurability application is waived. If you would like to take advantage of this new hire perk, you will be required to add the disability plans as part of your first enrollment. If you decline these now and in the future decide to enroll in disability plans, you may be subject to an EOI application to provide information about your medical history. The insurance company would then review your medical history and determine whether they would decide to approve you for these plans, deny you, or ask you to complete a medical examination. So again, if you'd like to take advantage and be instantly approved with no question asked about your medical history, please make sure that you add the disability plans as part of your initial enrollment. Life insurance and AD&D. Unforeseen events such as the loss of a loved one can happen at any time, and without proper planning and protection, these unexpected hardships can have a profound impact on you and your family. So earlier, you learned that the basic coverage package includes, in addition to the medical, UT Select Plan, and pharmacy benefit, it also includes a $50,000 basic life and $50,000 basic AD&D benefit at no cost. If you are interested in supplementing life insurance and AD&D, you can enroll in voluntary plans to cover and insure your life, dependent's life, a spouse life, and also enroll in AD&D voluntary plans to cover your life, spouse, or dependent children. With the voluntary life insurance, if you choose to enroll in coverage to cover your own life, you'll have the option to choose a benefit that ranges from 1 times your salary all the way up to 10 times your annual compensation, not to exceed a benefit amount of $2 million. With the dependent life insurance, you'll have a benefit amount of $10,000, and you can add that benefit for spouse and children. You can also enroll in voluntary life insurance to cover the life of your spouse and choose between a flat amount of $15,000 or $40,000. And then again, with AD&D, you can cover your life, spouse, or dependent children. Now, similar to the disability plans, as a new hire, you have an added perk where you can enroll in life insurance to cover your life and elect an amount of 1 times, 2 times, up to 3 times your pay, and be instantly approved with no questions asked about your medical history. In other words, the
requirement for an evidence of insurability application would be waived. So again, this is an added perk available for new hires that you can be instantly approved all the way up to 3 times your annual compensation if you decide to buy life insurance to cover your life. If you elect, let's say, for example, in the maximum amount of 10 times your pay to cover your life, you'll be instantly approved up to the 3x amount and start to pay the premium for that 3x benefit. You would then fill out an evidence of insurability, which is basically a questionnaire asking you about your medical history for the additional amount that you elected, in this example, 10 times your pay. The insurance company would then review your EOI application, and you might be approved or denied or asked to complete medical examination. If you're approved, you will begin to pay a new premium on that increased 10x benefit, which would kick in as of the first of the month following your approval date. If you happen to be denied on the 10x amount, you would just continue with your 3x amount and continue paying the premium for the 3x benefit. Now, similar with the disability plans, if you want to take advantage of this EOI waiver, you must add the life insurance as part of your first enrollment if you happen to be a July or August new hire that's needing to complete a dual enrollment process. So again, if you want to take advantage of this and you have to do a dual enrollment, make sure you add life insurance to cover your life as part of your first initial enrollment up to the 3x benefit to get that EOI waiver approved. If you choose to decline these now and then at some point in the future decide to enroll in these plans, at that point, regardless if it's 1x, 2x, or 3x or higher, you may be subject to the evidence of insurability application. We do not have the premiums listed on the slide as they are based on your age and salary, so you'll be able to see those during your enrollment. And for the AD&D plans, you are never required to answer questions about your medical history or complete an EOI application.
Now we will review the mandatory retirement saving plans. Teacher Retirement System of Texas. So what is TRS? TRS is a traditional defined benefit pension plan that provides a retirement annuity based on a formula. This plan operates under the Internal Revenue Code Section 401A. Participation in TRS is mandatory for all benefit eligible employees, and enrollment is automatic starting on your first day of employment. No action is required on your part to enroll in TRS. We receive many questions about opting out of this plan, so please make note that if you are working in a benefits eligible position, you cannot opt out from the TRS plan. Employees contribute 8.25% of their eligible earnings on a pre-tax basis each pay period. While UTD contributes an additional 8.25%, this employer contribution is not a match. Instead, it goes into the TRS general pool to fund the retiree pension. As a defined benefit plan, TRS manages the investments. Retirement benefits are determined using a formula that factors in years of service, credit with TRS, annual salary, and a multiplier set by the state law. The standard annuity calculation used to determine your monthly annuity at retirement is as follows. First, to calculate the average salary, you will take the average of the 5 highest annual salaries. The total percentage is your years of service multiplied by a 2.3% multiplier. Then you multiply the total percentage of your average salary to get the annual annuity amount. You will then divide the annual annuity by 12 to determine your lifetime monthly annuity. Employees become vested after 5 years of participation and can receive a lifetime annuity from TRS once they meet the age and service requirements for retirement. Normal retirement is age 62 and the rule of 80, meaning your age plus your years of service equal 80. The average salary is determined by your tier, which depends on your hire date or when your TRS membership began. For more details, please check the TRS website if you have prior TRS service. You can view your employee contributions by accessing your MyTRS account on the TRS website. If you're new to TRS, allow 2 to 3 pay periods for your information to be processed before accessing your account. It may take 2 to 3 months for your account to be available due to reporting timelines. Once you receive your TRS member ID and beneficiary form by mail, you'll be able to access your account. Please be sure to complete the beneficiary form and send it directly to TRS by mail or fax. You can also update your beneficiary information through the MyTRS portal. If you leave your job, you may request a refund or rollover of your employee contributions only. Employee contributions are not considered a match and will not be distributed. If you're vested and request a refund or rollover, you will lose your vesting status and eligibility for a lifetime annuity, so please keep that in mind. The maximum salary that will be considered for TRS benefits is $345,000, which went into effect as of 9/1/2024. On the TRS plan, death and disability benefits are also available under this plan. Optional Retirement Program, also referred to as ORP. The Optional Retirement Program is another mandatory retirement option where eligibility is dependent on certain positions. If you're appointed to an ORP eligible position, you will automatically be enrolled in TRS as of your date of hire, but you'll have 90 days to sign up for ORP if you prefer it over TRS. Employees contribute 6.65% of eligible earnings on a pre-tax basis each pay period, and UTD contributes an additional 8.5%. The ORP is a 403(b) defined contribution plan where employees manage their own investment. The account growth is based on performance of the chosen investment portfolio. You have 5 approved vendors available to assist you with your investment decisions. Choosing ORP is a once-in-a-lifetime irrevocable decision. Eligible employees will have a 90-day window to enroll in ORP in lieu of TRS. If eligible, an employee will receive an ORP notice sent to your UTD email. If you are not in an eligible ORP position now, but your position changes in the future and you become eligible for ORP, the benefits office will notify you via email and you will have 90 days to enroll. Eligible positions include full-time faculty, senior administrative positions, and some other roles such as librarians, athletic coaches, and directors may also qualify. Contribution limits, so the combined ORP and tax-sheltered annuity limit is $69,000. Vesting, you become vested after 1 year and 1 day of active participation with the right to employer matching contributions. The maximum salary is set at $350,000, effective with paycheck dated January 1, 2025, and is subject to change based on IRS regulations. Note that there are no death or disability benefits associated with this plan. Voluntary retirement saving plans are also available in addition to the mandatory retirement plans. You can choose from 5 approved retirement providers to invest in or enroll with. We have Corebridge, Fidelity, Lincoln, TIA, and Voya. You have the flexibility to select one or all 5 based on your investment preferences and service needs. Each provider offers advisors who can assist you in creating a tailored retirement portfolio. Additionally, many provide online planning tools, allowing you to independently manage and track your portfolio. Participating in a 403(b) tax-sheltered annuity and/or a 457(b) deferred compensation plan is a great way to save more towards your retirement. Both plans offer 2 options, a pre-tax, which is your traditional plan, and a post-tax, which is your Roth plan, giving you the flexibility to choose how to contribute, whether you contribute pre-tax, post-tax, or use a combination of both. While the plans are similar, the key difference that may be most relevant to you is that the 457 Deferred Compensation Plan does not impose a 10% penalty for early withdrawals before age 59 and a half. Here's a quick summary of the differences between traditional and post contributions. Traditional contributions are made before taxes, meaning you won't pay taxes on the money you contribute now. However, when you withdraw the funds in the future, you'll pay taxes on the amount withdrawn. This can help reduce your taxable income and potentially lower your tax bracket. It's recommended to consult with a tax professional to determine which option is best for your situation. Roth contributions are made after taxes have been deducted, meaning that when you withdraw the funds in your retirement, your withdrawals will be tax-free. This allows your contribution and earnings to grow without being taxed. There's no set deadline for enrolling in the voluntary retirement plans, so you can take your time and decide how much to contribute once your finances stabilize. To enroll, adjust your contributions, or cancel a plan, simply log into the UT Retirement Manager system at any time during the year. If you make your changes by the 10th of the month, your contributions will be reflected in that month's paycheck. Anyone who receives a paycheck from UT Dallas is eligible to contribute, regardless of your benefits eligibility or appointment status. As mentioned, we have 5 approved providers for you to choose from, and we highly recommend you schedule a free consultation with one of them for personalized financial planning advice. UT Systems Retired Employee Group Insurance provides retiree benefits for life upon retirement, as long as you meet the eligibility criteria for retirement from both TRS or ORP and UT Dallas. UT Retiree Insurance includes continued coverage for medical, dental, vision, and the option to purchase additional voluntary retiree life insurance with coverage up to $100,000. Basic retiree life insurance is free and offers coverage up to $10,000. These benefits are available for you and your eligible dependents for life. To be eligible, you must meet one of the following conditions. The Rule of 80, which is your age plus your years of credible state service, equals 80, plus 10 years of total state service, or age 65 with 10 years of total state service. Additionally, you must meet the following criteria: 10 years of service with UT System, or 3 years if employed in a benefits eligible position at UT System as of August 31, 2003. You must file for retirement with TRS or ORP, and benefits are available if approved for TRS disability retirement. If you have service credited with another state agency, those years may count towards your eligibility. If you are unsure whether your service from another state agency counts, please contact the benefits office for assistance. Now we will go over the benefits enrollment process. Benefits enrollment steps. Once your information is uploaded into the MyUT Benefits Enrollment Portal, you will receive an email notification inviting you to complete your benefits enrollment. If you don't receive this email within 2 weeks of your start date, please contact benefits@utdallas.edu for assistance. The email will include a link to the MyUT Benefits Enrollment Portal, but you can also access the enrollment portal through Galaxy Gemini by selecting Self-Service and then selecting the MyUT Benefits tile. You can log into the MyUT Benefits Enrollment Portal using your single sign-on credentials from Galaxy. When adding dependents, please make sure to upload the necessary verification documents in MyUT Benefits. For a spouse, you'll need to provide a marriage certificate. For children, submit their birth certificate or adoption papers from the court. If you're enrolling in group life insurance that exceeds 3 times your salary or enrolling additional spouse life insurance, please be sure to complete the evidence of insurability. Finally, make sure to review your first paycheck. If you notice any errors or have questions regarding your deductions or credits, please reach out to our office immediately so we can address them. Double deductions and effective date options. We are paid monthly, with payments made on the first working day of each month. Insurance premiums are deducted in arrears, meaning your paycheck will cover premiums for the previous month. We do not prorate insurance premiums. For instance, if you are hired on the last day of the month, you'll still be charged the full monthly premium, even if you're only covered for one day. If your first paycheck does not include insurance premiums, it may be due to timing of your enrollment and our payroll deadlines. And you might see a double deduction on your next paycheck. To avoid a double deduction, you have the option to request a change in effective date to the first of the month following. This option may be helpful if you have coverage through your previous employer until the end of the month, as it can prevent a double deduction based on the timing of your enrollment. If you're interested in making this change, please process your benefit elections first. Once you have completed your enrollment and uploaded any necessary documents, email benefits@utdallas.edu to request the change in date. ID cards. Here are the example of the insurance cards you will receive depending on your enrollment. You can expect to receive a Blue Cross Blue Shield medical card and an Express Scripts prescription card about 2 weeks after your enrollment. These cards may arrive earlier than expected, as medical insurance is auto-enrolled for full-time employees on the date your information is loaded to the MyUT Benefits enrollment system. The insurance cards will be issued in the primary member's name, so if you're covering dependents, their names will not appear on the card. This means that you can use your card for all individuals enrolled in your plan. If you are participating in the Health Flex spending account, you will receive a Flex card, which typically arrives in a plain envelope. Be sure to check your mail carefully, as it is easily mistaken for junk mail and accidentally discarded. Keep in mind that your Flex cards are valid for multiple years until the expiration date printed on the card. For vision and dental insurance, you do not need to present a physical card for service. Simply inform your vision and dental provider that Superior Vision is your vision insurance provider and Delta Dental is your dental insurance provider. They will contact the insurance company to verify your coverage. All of these insurance providers offer web and app access, where you can download virtual cards and view your account information. For more details, please visit our website. ORP and Voluntary Retirement Plan Enrollment. Enrollment in ORP or the Voluntary Retirement Programs are made by logging into the UT Retirement Manager system. We recommend you schedule an appointment with an approved UT System retirement advisor to determine which plan is best suited for you. A retirement advisor can put together a retirement portfolio and provide online planning tools to help you manage and track your portfolio on your own. You can refer to the UTRM guide for help with your registration and account setup. Changes including adding plans, canceling plans, or changing contributions to these voluntary plans can be made at any time of the year. As long as you set up your contributions by the 10th of the month, it will be reflected on the following paycheck. If you are eligible for ORP, please remember that you have 90 days to enroll in ORP. Now let's take a look at important reminders. Important enrollment reminders. Please make sure to review your address to ensure it is current. If a change is needed, you may update your address via the Galaxy Gemini system. Review benefit options via the MyUT Benefits enrollment portal. Be sure to look for your enrollment notice via your UTD email. If you do not receive a notice within 2 weeks from your hire date, please email benefits@utdallas.edu. Enroll in benefits within 31 days of hire or eligibility. Enroll in the voluntary retirement plans via the UT Retirement Manager system. Complete evidence of insurability if necessary within 31 days. Upload dependent verification documents if needed. Also, be sure to assign beneficiary designations. So remember, even if you do not enroll in the voluntary life or AD&D coverage, if you are enrolled in medical, you are automatically enrolled in the basic life and basic accidental death and dismemberment plans. So please be sure to designate beneficiaries for those plans. Save a copy of your elections by printing your benefit confirmation statement. Review benefit deductions on your first and second paychecks. And be sure to look for ID cards in the mail within 2 weeks of completing your enrollment. If covering your dependents, you will not receive a card in their names. The insurance cards will be in the primary subscriber's name, but your dependents can use your cards for verification of coverage. Email benefits@utdallas.edu with any discrepancies as soon as possible. If you are eligible for ORP and will be electing to enroll in ORP, be sure to look for your ORP notice via your UTD email. Ensure you complete and submit your TRS-28 form within 90 days of eligibility. This presentation will be shared with everyone, allowing you to review the list afterwards and use it as a checklist. Here's the benefits team ready to assist you. Our team is led by Marita Yancey, Senior Benefits and Wellness Director. Tina Sharpling is our HRIS Manager who provides HRIS and technical support to the team. The leave team includes Leave Manager Rhonda Rogers and Leave Coordinators Karen Upilo and Diana Palmer, who are available to assist with questions about FMLA, parental leave, the sick leave pool, or any other leave of absence inquiries. Our benefits analyst are T. Wen, who oversees reporting, funding, and billing for benefit and retirement plans, and Berenice Ortiz, who manages absence management as well as vacation and sick leave. Taylor Tran is our employee wellness manager, who is here to assist with nutrition and health promotion. And finally, our benefits manager, Pearl Gutierrez, is supported by benefits specialist Audrey Mitchell, Julie Sun, Nora Peña, and Sumi Shrivastava. Although we each manage specific departments, feel free to reach out to anyone on the team. We're always here to help. You can contact us directly or email benefits@utdallas.edu with any questions. Remember, we're here to support you from hire to retire and beyond. Please be sure your next of kin has our contact information. If anything happens, don't hesitate to reach out so we can review your benefits and provide the best support for your circumstances. Here are some resources for your review with active links for easy reference. This presentation will be shared with you, so you can always refer back to this page as needed.
As a disclaimer, this presentation offers a general overview of UT system benefits with full details available in official plan guides, which will take precedence in case of discrepancies and may be amended at the system's discretion.
This concludes the presentation. Welcome to UT Dallas. If you have any questions, feel free to ask them now, or you can email us at benefits.utdallas.edu.